all, actually, just to introduce myself to those of you who don't know me. My name is Sophie Hambleton. I'm a professor of paediatrics and immunology, and I'm one of the deputy deans in the Translational and Clinical Research Institute in Newcastle University. And for the past few years, I've been involved with the Academy of Medical Sciences in various ways. And recently I've joined the panel that reviews applications to this scheme. So that's why I've been asked to talk to you today. And I'm sorry, you've probably just recapped some of this, and actually I hope that you're all aware this is a really important funding scheme for academic clinical lecturers who are looking for their first independent research funding post PhD or MD. And the value of the scheme has been recently increased so that it can provide you £40,000 over up to 2 years. And while you can't employ the whole of another person and pay their salary from this, you can use it for technical support, which might include a contribution to someone's salary, as well as consumables and facilities costs. And the idea of the scheme, which runs twice a year, is to provide you with the resources you need to gather data and expertise that will prepare you for future applications for funding, in particular for research fellowships. And at the bottom there, you can see that various different organisations funnel funding towards this scheme through the Academy of Medical Sciences. Sorry, I'm just having slight trouble advancing my slides. Yeah. So compared to other funding schemes, there are quite a lot of advantages. So as ACLs, you're not competing with basic scientists in this scheme. It's only for you. And it's quite quick. With 2 rounds a year, they actually turn around the review process and feed back to you quite quickly, which of course is important given the fixed duration of the ACL and the kind of tight timescales. But that's quite nimble, really, on the part of the organisation. And the other thing is that the success rate is pretty good compared with other schemes. And you are allowed to reapply once within the rules of the programme, although, as we were just discussing, there are some caveats around its timing in relation to the beginning and end of your ACL. So it's quite good value for the AMS. They've recently done another evaluation programme. They do these every few years. You know, they put a lot of money into this scheme, but they can see that they get a really good return because those people who obtain these starter grants, a significant proportion of them continue in research, get fellowships, they bring in a lot of research funding for their future research, and they report that it has a major positive impact on things like their publications, their collaborative networks, and their career progress. So it is an important first step that can also be a way of kind of cutting your teeth in writing your first grant. So the timetable looks like this. And so we're coming towards the end of the application period. It says March there, but it's the 26th of February, I think, the closing date for the current round. But then you can be preparing actively for the later round, which will open in the summer and close in September. And these are the steps that the Academy has to go through in short order. So they check eligibility, and then the applications are all peer reviewed. And then there's a panel review, and all of the applications are discussed at panel. So this is another way actually in which it's different from many other funding schemes. So everyone gets a real crack of the whip. Most of the applications come to the panel meeting, which takes place at the dates that you see, and then pretty quickly after that, the outcome will be released to you. And I think we've recapped this eligibility already, but you do have to be clinically active in medical, dental, or veterinary medicine, and you have to be within high specialist training. And the application process, all of this is laid out really, really well on the AMS website, which I suggest you get very well acquainted with. They have a copy there of a sort of online, the online web form, but it's in the form of a PDF. So you can download that and see all the sections and the word count for each part. And it is still quite a substantial application. So give yourself a good run up at this. And so, for example, if you haven't already got well on with your preparations for the current round, then I suggest that you should be aiming for the next round, because there's quite a lot to think about. Of course, there's lots around the research project itself, and we'll talk a bit more about that in a moment. But there are also some kind of underpinning things that have to be in place. So you do need to get costings done through the organisation which is going to host you. And so at Newcastle University, the process for that involves a project initiation form, which will probably need to be tagged to your academic supervisor, because they have the relevant kind of identity within the university systems, and they will be able to advise you about this part. But that does take several weeks, and you want to make friends with the people in the costings teams, research support teams, so don't leave that until the last minute. And the other thing that you're going to need for your application is that you need to get the sort of endorsement in the form of an electronic signature from various named people within your application and host organisation. So that's head of department, your clinical supervisor, and your academic supervisor as named within the application, and a finance officer on behalf of your host organisation. And those are all sort of fairly standard, but what's helpful if you're in one of those positions is to be warned that you will need to go into the system and do this electronic signature process within certain dates. Yes, so I just wanted to talk a little bit about the contents of the application and some pointers as to, important points to consider when you're putting it together. And bear in mind that the funding panel will be seeing a very large number of applications, usually tens, somewhere between 50 and 100 each round. Each member of the panel will look in detail at a subset of those, and they're all discussed together. So you want to be really clear. You want to make the reviewers and panelists' job easy by really putting your best foot forward and making it easy for them to see why you are an ideal candidate. So there are the form is divided into certain sections that are about you and your past achievements and your career trajectory, and it's broken down into many sections. So just make sure that you really read the form, you read the accompanying guidance, of which there's lots, and address the questions. So one of them, for example, is about the aims and objectives of your current post. So that means your current ACL position, which has both clinical and research components, what is it you're trying to achieve within the post? So just make sure that you include what your clinical training goals and requirements are, as well as your research ones. And there might be quite a lot of elements of research training even within that piece, as well as what the starter grant's going to be about, which is generating preliminary data and refining your research ideas with a view to future fellowship funding. In different parts of the form, there is one question about your future career aspirations. That comes early in the form in the part about you. And then there's another bit towards the end of the form about the importance of the starter grant to you. And I suggest that you think about those together, because you don't want to waste space by repeating yourself in those two areas. So I suggest to you that the career aspirations part is for you to kind of lay out your grand plan, as in, you know, do you want to be a clinical academic in the long term? How do you see yourself? Are you going to be mainly a clinician that does a bit of research, or the other way round? And how does it all fit together? What general area do you want to be in? And so you can be quite bold and ambitious. The section on the importance of the starter grant to you is also really, really important, because the Academy wants to be making a difference with its funding. And so if you can demonstrate how this fills an important gap that will really allow you to springboard to the next part of your career, then that's what that section is for, in my view. And sometimes, I must say at panel, you know, it comes down to very small differences between applications. And in that circumstance, looking at this point, the importance of the starter grant to you and your career does assume a bit more importance. So that's, I wrote down some of these things in boxes. Yes, so those were my my reminders about that first section. The training thing, it doesn't, the starter grant costings part, it doesn't really encourage you to spend money within the starter grant on your training, but of course you should be able to access some training funds as part of your ACL. And in any case, we're all engaged in lifelong learning. So I think it's still appropriate to show that you're continuing to gain research skills, that you plan to continue to acquire new research skills through your ACL and through your starter grant. Okay, you haven't finished the learning process at that point. I always look for that myself. So then we come to the meat of your actual planned research. And this is broken down into scientific and lay summaries, as well as a 1,000-word research proposal, which you may realize that having written your PhD theses, you know, this is extremely short. So there's a fine balance to be made here between communicating the sort of the vision and the importance of the research versus reassuring that you are across the details and that you've considered the feasibility within the time and budget that you have available. One thing to note is that the tables and figures section is much less limited. And furthermore, I put it to you that diagrams can often tell 1,000 words. So make sure that you use the opportunity to include figures, tables if you want, as very much as part of your application, both to kind of draw out the kind of research abstract, if you like, the overall structure of the thing, and potentially to provide more methodological detail than you can fit into your 1,000 words. Regarding the summaries, these are, of course, I mean, every section's important, but these are really important because they're where your reviewers are likely to start. And in particular, the lay summary is really your opportunity to communicate the importance and the elegance, I hope, of your proposal. There is detailed additional guidance over and above what's in the PDF of the application form guidance notes. There's additional guidance on the AMS website about how to write a good lay summary, and I commend that to you. Finally, of course, there are questions about your research environment, your clinical and academic supervisor, and your collaborations. And you need to reassure the panel that you're in exactly the right place to be doing your research, or at least that you are connected with the right sources of support for your research. And that covers both scientific facilities, maybe some technical expertise, as well as mentorship. And I think for the purposes of this scheme, it's good if you demonstrate that you already have perhaps informal mentors in place, but the AMS does provide a mentoring scheme for applicants to this grant scheme, whether or not you're successful, in fact. And so part of demonstrating the importance or the usefulness of the grant to you might be to mention that you plan to avail yourself of the mentoring scheme. Okay, so an important part of the learning process regarding the grantsmanship and so on, in my view, is very much to share your draft application with your supervisors, mentors, trusted colleagues who will look at it for you and provide feedback that you also have time to respond to. In my experience, that is the way to prepare a really good application. And it takes guts to share what you feel might not be a complete and perfected article, but it's an important research skill that you'll need to draw upon also in the future. So it's sort of, it works on multiple levels, and if you're not ready to share it with those people who are all friendly folks who are on your side, then you may not be ready to share it with potentially less friendly reviewers and so on. Of course, that 43% success rate that I mentioned to you implies a 57% non-success rate. And so, there's a built-in risk here that you don't get awarded the starter grant, but don't give up. Think about having a plan B, and you'll know how your own psychology works, but sometimes it's good to have those plans B in mind before you hear the outcome of your starter grant application. So as well as your supervisors, peers, people like me, people like Amy and co in NHRP Academy, the AMS, in my experience, is quite a friendly organisation. They do have very good information on their website, which you see at the top there. Underneath that, I put a link to a recent article, which is an account by someone who successfully applied for a starter grant in the last round, just kind of mentioning his experience and his tips for a good application. But that was all I was going to say here, and maybe we can use the rest of the time for any questions that people might have